Unsteadiness after sex doesn't for the most part show a genuine basic medical issue. Much of the time, the dazedness is because of overexertion, thirst, or craving. Nonetheless, extreme or successive wooziness can be a reason for concern, particularly if different manifestations are available. In this article, we plot 10 potential reasons for unsteadiness after sex. We likewise give tips on treating and forestalling wooziness after sex and disclose when to see a specialist. 1. Lack of hydration. As indicated by the American Heart Association, AHA, drying out can in some cases cause an individual's circulatory strain to drop. Lack of hydration, in any event, when mellow, can likewise cause different indications, for example, tipsiness, shortcoming, exhaustion. An individual may get dried out on the off chance that they don't drink enough liquids previously or during sex. Become familiar with lack of hydration here. 2. Craving. Craving causes a drop in blood glucose levels, which can prompt the accompanying side effects. Unsteadiness. Unsteadiness. Precariousness. Blacking out. Unsteadiness after sex can happen if sex has briefly occupied an individual from their appetite. In any case, visit craving or wooziness can here and there be an indication of diabetes. Individuals who experience such manifestations should see a specialist for a determination. 3. Changes in relaxing. Sexual excitement can make individuals inhale more profoundly and quickly than expected. These progressions can prompt a diminishing in the measure of carbon dioxide in the blood. The clinical term for this procedure is hyperventilation. Some likely side effects of hyperventilation include discombobulation, quick heartbeat, windedness, deadness or shivering in the hands or feet, uneasiness, swooning. Breathing gradually and profoundly normally facilitates side effects of hyperventilation. Notwithstanding, individuals encountering uneasiness or fits of anxiety might be not able to inhale profoundly. An individual should converse with their PCP about different techniques for dealing with these conditions. 4. Changes in stance or position. Postural orthostatic tachycardia condition, POTS, causes an individual's pulse to increment unexpectedly when they switch positions or stand up excessively fast. An expanded pulse may cause the individual to feel mixed up and could even resent them to swoon. Other potential side effects of POTS include discombobulation, heart palpitations, quakes, chest torment, sickness. A few people notice side effects when they change positions during sex. POTS isn't normally risky. In any case, an individual encountering the above manifestations should see a specialist to guarantee that they don't have a hidden issue with their heart. 5. Hormonal swings. Sex creates a groundbreaking blend of hormones and synapses. For certain individuals, these synthetic concoctions cause transitory sentiments of serious happiness that may prompt dazedness. Others may encounter tipsiness as the body comes back to its ordinary state and discharges less sex-related synthetic concoctions. Dopamine is a neurochemical that can assist individuals with feeling propelled and cheerful during sex. Drugs that impersonate dopamine in the mind can cause unsteadiness as a symptom. It is conceivable that individuals who experience a characteristic dopamine surge during sex may likewise encounter dazedness. 6. Vertigo. Vertigo is a sort of tipsiness that makes an individual vibe like they are turning. Other potential side effects of vertigo include loss of equalization, wheeziness, spewing. A few people report encountering vertigo after sex. Vertigo might be because of issues with the internal ear, which controls an individual's development and feeling of parity. Individuals who create vertigo after sex regularly experience vertigo at different occasions too. For instance, they may have indications when practicing or standing up excessively fast. 7. Hypertension. Sex can expand pulse. This impact is particularly likely if an individual has intercourse for an extensive stretch or participates in extraordinary sex that spellbinds them. Hypertension can cause discombobulation. An individual may see that the discombobulation compounds as sex increases and step-by-step facilitates as their pulse comes back to typical. Any individual who is worried that they may have hypertension should visit their PCP for a pulse per using. 8. Low pulse. Low pulse may likewise cause wooziness after sex. Sex can cause an extraordinary surge of feelings that invigorate the vagus nerve that communicates data between the mind and the remainder of the body. Overstimulation of this nerve briefly expands the veins, in this way bringing down circulatory strain. Specialists call this vasovagal syncope, versus. Some potential side effects of versus include dazedness, disarray, unsteadiness, feeling hot, seeing dull spots in the eyes, blacking out. In the event that an individual with versus blacks out, their circulatory strain as a rule comes back to ordinary moderately rapidly. In the event that they don't swoon, full recuperation may take a couple of moments. 9. Stroke. A stroke happens when there is an absence of blood stream to the cerebrum, which can happen because of a blocked or spilling vein. A stroke during sex is an uncommon event, however it can occur. Certain gatherings of individuals are at higher hazard, including more seasoned grown-ups, individuals who have a background marked by heart medical issues, individuals who have recently had a stroke. Abrupt, exceptional tipsiness that doesn't improve can be an admonition indication of a stroke. Other potential side effects of stroke include hanging on one side of the face, an unexpected lopsided grin, deadness or shivering, particularly on the off chance that it is simply on one side of the body, failure to raise the two arms to a similar tallness, slurred discourse, disarray, loss of awareness. An individual who feels that they or another person might be encountering a stroke should telephone 911 right away. Brief clinical treatment diminishes the danger of genuine intricacies and demise. 10. Heart medical problems. Discombobulation after sex isn't generally genuine. Be that as it may, it can now and again be an indication of a heart medical problem. Such issues are more normal among individuals with at least one of the accompanying danger factors for coronary illness. Hypertension. Weight. A background marked by heart medical issues. A family ancestry of coronary episode. The following are some extra manifestations that may show a heart medical problem. Chest torment, heart palpitations, trouble relaxing, unsteadiness that endures longer than a couple of moments, dazedness after exercise. Visit dazedness. Recognizing the reason. An individual who feels discombobulated after sex can limit the expected causes by asking themselves the accompanying inquiries. Have they eaten enough food? Have they drank enough water? Do they feel on edge or froze? Do they have a past filled with hypertension or heart medical issues? Does the wooziness disappear rapidly, or does it wait? Does the wooziness happen each time they have intercourse, or is it just an infrequent event? Treatment and anticipation. Any individual who encounters a stroke or different genuine heart condition should telephone 911 for crisis treatment. Brief treatment of either condition diminishes the danger of genuine difficulties and passing. Individuals with interminable circulatory strain issues may need to take drugs and make certain way of life changes to deal with their pulse. For the individuals who don't have a fundamental well-being condition, the accompanying techniques may help treat or forestall sex-related dazedness. Taking breaks during long sex meetings to drink water or eat a bite. Abstaining from standing excessively fast during or after sex. Straining the legs and different muscles to raise pulse and forestall blacking out when feeling bleary-eyed. Crossing the legs to advance more severe hypertension. trying different things with various sexual situations to discover those that are less inclined to cause wooziness. When to see a specialist. Discombobulation after sex regularly disappears all alone without the requirement for clinical treatment. On the off chance that unsteadiness happens regularly or happens nearby different side effects, an individual should call their PCP to plan an arrangement. It is essential to look for crisis clinical treatment for tipsiness that goes with any of the accompanying side effects. Deadness or shortcoming on one side of the face or body. Chest torment or weight. Torment in one arm. Run down. Tipsiness after sex has numerous possible causes. Some are generally favorable, while others could show a hidden issue with the heart or circulatory framework. By and large, tipsiness after sex disappears all alone. Individuals might have the option to treat an episode of dazedness by straining or intersection the legs or drinking a glass of water. Nonetheless, an individual should see a specialist on the off chance that they experience unsteadiness, particularly in the event that it happens alongside different side effects. The specialist ought to have the option to analyze the reason and give suitable medicines.